Good evening and welcome to Clear on Health, a health education program that airs on Africa Health Television on TSTV. Today we will discuss the antenatal period and the antenatal care. Pregnancy in primates is a physiological process where the newly formed embryo and then fetus is incubated for a period of time to such a time that is capable of existence outside the body of the mother. The woman is usually well prepared for this, and as a physiological process, it is often, or we will have thought that nothing should go wrong at all, and usually that is the case, that period reaches the gestation for that animal species, and nothing happens, and there is a safe delivery. For humans, because it has been noticed that things can go awry and there can be maternal mortality occurring or just morbidity, there is a period that is carved out and called the antenatal period, and there is a care that is called antenatal care. What is this period and what is this care? We will be discussing this, and we will expect that you will bring your perspectives in, or you will seek for clarification, and by looking at the number on the screen, and the number is 0907 111 5342. 0907 111 5342. Please, you should call us so that we can hear your perspective. I'm lucky to have two discussants today. With me is Matron Jane Abo. He's a nurse educator. You're welcome, ma.
Thank you very much.
Dr. Liman Idris Mohammed has been with me several times. You're welcome again, sir.
Thank you.
He's a consultant obstetrician and gynecologist at the National Hospital, Abuja. Now, by way of starting, ma, what is the antenatal period, and what is the purpose of antenatal care?
Right. Good evening, viewers. I'll start by defining what antenatal care is all about. Antenatal care is a care provided by a skilled health professional to a pregnant woman, an adolescent girl, in order for them to achieve the best health care for the baby and the mother. It has like about 4 components. One of them is risk identification, then prevention and management of pregnancy-related diseases, health education, and health promotion.
Okay. Okay, fine. Maybe we will go into the details of those one by one. Now, maybe Dr. Liman will tell us, first of all, if there are any changes that occur in the body of the pregnant woman before we continue to discuss, those aspects of antenatal care.
Yes, thank you, moderator. Pregnancy actually is a whole lot of changes in the, expectant mother. And that is how, first of all, the woman herself will realize that she is pregnant. The simple and the first and foremost change is that she will miss her period, that is menstruation, which she has been, passing through on a monthly basis. Then she will find out, I have not menstruated this month, what is going on? And as pregnancy is established, then the body chemistry started to change from the non-pregnant state to pregnancy state. Is a whole lot of changes that affect the psyche or psychological activity of the mother, the heart rate, the kidney functions, the blood formation and blood volume, and all sort of changes will take place in that order as a pregnancy established as a result of increased pregnancy hormones, most importantly progesterone and estrogen. Now, as this continue, the patient now realizes that her abdomen or tummy starts becoming bigger and bigger. This is another major change, and it is at this point that most outsiders, outside the pregnant woman herself, will be thinking that this patient or this woman whose tummy is becoming bigger and bigger is most likely, pregnant. And it continues like that until, the changes started transforming to changes that will bring about labor and delivery of this fetus. So if we want to talk about changes in pregnancy, it is going to be the only subject matter. But suffice to say that, yes, indeed, a lot of changes, and it's multi-systemic changes, right from the psychological aspect of the woman down to bodily, functions, and then bodily growth. And part of this bodily growth that I talk about, that the tummy will be increasing in size, is because this baby that is formed there, that is hitherto small, continue to become bigger and bigger until the size of normal babies we see when somebody put to bed. Thank you.
Okay. Now, for humans, there are about 280 days of pregnancy. At what time should a woman begin to have antenatal care, Dr. Liban?
Well,
when should she come for antenatal care? Because in our society, people tend to hide the pregnancy until it's obvious. That's like 4 months. But actually, at what time should a woman begin to come for antenatal care?
Yeah, it is strongly advised once a pregnancy has reached first 3 months, 13 weeks, then the woman can start antenatal care. But there are instances, we've had Michael discussant talking about risk assessment. There are some instances that as soon as menstrual period is missed, we advise go and seek attention of your healthcare providers, should in case it is pregnancy. It's at that point that pregnancy care in terms of antenatal will begin. First of all, confirming that this pregnancy is actually a pregnancy, normal pregnancy, and is located in the normal place. If it is pregnancy and it's an abnormal place, that is already a problem, and that must be addressed as soon as possible. So, but under normal circumstances, a woman becomes pregnant after first 3 months, she should start antenatal care.
Okay, so first of all, the woman should see a doctor or a clinician to identify
that she's pregnant,
and that it's in the normal place.
Yes.
And that it is a pregnancy.
It's a pregnancy, not any other thing making the menses not to come.
What are the other things that could make menses not to come, or could be pregnancy that is not a baby?
Yes. We have a missing menstrual period is the first thing that heralds the thinking of pregnancy or not. Now, if it is pregnancy, it could be normal pregnancy, that is a well-formed, genetic combination of a normal pregnancy, which by accident of time and events decided to be located outside the womb cavity, where naturally it should locate and be accommodated properly till 9 months or 10 months that the pregnancy can be delivered. In that case, we call it ectopic pregnancy. We stress this so strongly, especially if a woman has had such experience before the current episode. So we want to know that as soon as you miss your period, is it again an ectopic pregnancy or it is normal pregnancy? That is one. Two, if a woman misses period, it could be an abnormal pregnancy. That is pregnancy that is wrongly formed, so to say, but it's located in the womb. The ones we call gestational trophoblastic disease. It is a pregnancy, but the genetic combination is defective or is having some fault, and therefore a normal combination that will lead to the development of a normal fetus and baby at the end of the pregnancy did not occur. There are different grades of it, and that is really a complicated pregnancy ab initio. The first thing is to stop that process and then revert, the problem, the woman back to normal and then be hopeful that our next pregnancy, the genetic combination will be gotten correctly, and normal pregnancy and delivery can occur.
Okay, so there's an entity called you call it
gestational trophoblastic disease.
Oh, okay.
That
so
is,
I can simplify it by saying pregnancy pregnancy cell disease.
Yes, a
pregnancy
defective
cell disease
pregnancy,
that
where
occur.
combination that would have led to normal development, multiplication and development did not take place. And therefore, whatever is going on is in an abnormal form.
Okay, thank you very much. Okay, Mr. Jane, you were discussing the components of antenatal care. Maybe you elaborate more on it and also tell us how antenatal care is carried out. And, you know, because I think those two questions can go together.
Yes. I forgot something.
Yeah.
Yeah, the first question you asked about the antenatal period. Yes, I didn't go into that before you went to my next discussion. The antenatal period is a period at which conception takes place until delivery.
Okay.
That's the antenatal period. Immediately after the delivery of the baby and the expulsion of the placenta, that gives it another care, which is called postnatal care.
Yeah.
Right. And it's usually a period of 9 months for a normal, uncomplicated pregnancy. Yes.
Yeah, but how is antenatal care carried out? Okay, you have a group of women, a woman that is listening now that is getting pregnant for the first time, and you are trying to tell her, come to clinic. Yes. What are the things you tell her that this is how we do it? Okay.
There are two ways. There is this one-on-one with the doctor or with the midwife, a trained midwife or the doctor. And there is this group one, like in a facility, they'll decide to fix a date called antenatal day. Yes. And then all the women that came to register for antenatal will gather on that day. Okay. And then a trained midwife and trained nurses and even some untrained staff, because it encompasses a lot of things that you needed a help of someone who is not a trained personnel to participate in order to have a successful outcome. So they are gathered on that day. But normally, on the day, immediately we advise women that, just like my co-discussant said, immediately you discovered you're pregnant, come to the hospital for confirmation of the pregnancy. And immediately the pregnancy is confirmed, you should register for antenatal. While we are advocating for that we realize maybe because of our setting for economic reasons or whatever, the women, they don't like coming for antenatal on time. And there are so many complications and risks that are involved. A lot of women have lost their babies and even their lives because of some underlying complication that because of their late registration in antenatal was not detected. And one of the commonest causes is a rise in high blood pressure that leads to preeclampsia and eventual eclampsia that could claim the life of the woman. Yes. So we advocate that as soon as pregnancy is achieved, they should come and register. And then once, like in my facility, we have a date, usually on a Tuesday. All the women, they are booked to us that day. And then they'll come around, they'll gather around. You make sure that there's a conducive environment for them to sit down. Then the consultant ORG is there as well to see every complicated pregnancy, because the ones we oversee is the normal uncomplicated pregnancies. Yes, we gather them, send them for urine tests, which is most time the routine, after the initial antenatal investigations. Then we try to make it lively and interactive for them, just to encourage them to come around. We engage by praying to God, because we have to put God first in everything. And then we go into little exercise, singing and dancing, and involving in 1 or 2 exercises, just to make it lively. And then thereafter, then we go into the main thing, which is the palpation, taking of the weight of the woman, and then palpation just to know the position of the baby, the gestational age, and all of that, and also to dictate any abnormality. because in the process of doing that, you can also examine the woman from head to toe to check for anemia, to check for any abnormal growth in the body as well that could complicate the pregnancy. And after all of that is done, and then you'll also ask them questions if they have any problem relating to the pregnancy. They will let you know on that day, and any other issue. And thereafter, like, we have all the normal drugs we give to them for, we're in an endemic area for malaria. We give them malaria based on the trimester anyway.
Okay.
Yes, and also the antitetanus tozoid as well. We give them depending on the gestation as well. And then write out the normal routine take-home drugs, which is the hematinics for them to go and take, and then you give them a date for another visit.
Oh, that sounds a lot of fun that no woman should miss out on to come for antenatal care. We will take a break, but not until I remind us of the number again, 0907 111 5342. Please call us and add your perspective to the things we are discussing, or ask questions to clarify the things that one of us has said. When we come back, we will continue with the discussion. We take a break now. Welcome back, and if you are joining us for the first time, this is Clear on Health, a health education program that is aired on Africa Health Television on TSTV. Today we are discussing the pregnancy period and antenatal care in particular. I have with me in the studio Matron Jane Abo and Dr. Liman Mohamed Idris. We were already discussing what antenatal care is and the things that we do and the components and so on. There are two related interesting questions that I think that we should attend to quickly. One is what to avoid, and the other one is, can a woman have sex during antenatal period? Maybe we'll listen to your perspective first, Metro Jane. What do I avoid during antenatal care? What would a woman, should she avoid, for the safety of her pregnancy? And is sex one of those things she should avoid?
Right. One of the things we advise a pregnant woman to avoid is use of unprescribed drugs. Immediately pregnancy is achieved, we advise pregnant women not to take any drug that is not prescribed by a health professional. That is one thing we always like to emphasize. No matter what, even if it's ordinary Panadol as they call it, let it be under prescription. Then another thing again is the use of drugs. Like some ladies, though it's not very in our setting here, the use of drugs, and also alcohol, taking in of alcohol, then cigarette smoking. Those are some of the things we usually tell women, pregnant women against, because of its effect on the baby in their utero, and also for their well-being as well. Yes. Then when it comes to, and also vigorous exercise as well. We encourage exercise, but not a vigorous one. Yes. That's one other one again. We're talking about simple, uncomplicated pregnancy. Yes. Then for the issue of sex. No. A woman is advised to have sex. Sex has nothing to do with the pregnancy. If the pregnancy is normal and uncomplicated, there is no issue. Issues like maybe bleeding or whatever. But again, with my own experience, I've seen a woman came to complain that after a vigorous sexual activity with a husband, she has miscarried the baby. And this happened to people whom they normally, we term that has a very sensitive cervix. So for women like that, or if the pregnancy is...
Sorry, let's take this. Hello, you are on to Clear on Health. May we know who is speaking?
Okay, my name is Rose.
Rose, yes.
Okay, the question goes to Mitchell Jane above.
Okay.
Please, I'll find out when exactly should a pregnant woman start attending antenatal?
Right. Okay, thank you very much.
Thank you.
She will attend to that. Where are you calling from?
Okay, I'm calling from Asokoro, Abuja.
Okay. Thank you. Thank you very much. Okay. Mitchell,
yes.
Maybe you answer before you continue your discussion. Right. I think we've answered that, but I think you can make it clear.
Yes. Yeah, I think my Dr. Lehman answered that, but let me answer again. We said as soon as pregnancy is achieved, but we discover most women, they don't like coming on antenatal until some will wait till even the 3rd trimester. They will tell you, oh, we don't want to come and waste our time. They waste their time, they do this, they do that, they don't want to come until that point. But I discovered it's not healthy for the pregnant woman and her baby. So we want you, as soon as it has been confirmed pregnancy, come and register. And if you don't want to come so early, you can come any time as from 6 weeks to 8 weeks, or even from the 12th week, which is the 1st trimester. Just register. Because another thing, again, let me disabuse our mind, is that some of them, they think of the cost, thinking when they register early, it will cost them more. But fortunately, it is not so. In a facility where antenatal registration is 10,000.
Okay, sorry. Let's hear this. We'll continue. Hello, this is Clear on
Hello,
Health.
good evening.
Good evening, sir. Who are we speaking with and where are you speaking from?
Okay, my name is Phillips from Gogalada.
Phillips.
Yes, I want to say you are doing a very good job there.
Thank you.
A few questions I want to ask. You're talking about pregnancy, yeah. I want to know, because it takes two to decide when to get pregnant or not.
Okay.
In situations where probably you have, as a husband, you said you're okay with what you have, God has blessed you with, and story changed, and your wife says she's looking for what's it called, and she's pregnant. What do you do? How do you attend to that? Two, I want to know, is it possible to actually not know the real D-Day, the way they call it? So I want to know how you can tackle that as a couple.
Is it day of delivery?
Can you hear me?
You say, is it possible to know the real day? Which date?
Okay, that is the delivery date.
Oh, okay. Okay. Thank you very much.
All right.
Maybe Dr. Liman will take that after she concludes the answer she was giving already. I think you were about to conclude on
Yes, as I was saying before the call came in, the question the lady asked.
Yeah.
Whether you register early or not, you're paying the same cost.
Yeah.
there is no, like, because you register late, there will be a reduction for you. No.
So it's better
So
to
it is
register
better to
early and
register
enjoy.
early. Yeah, enjoy all the facility has for you.
Okay, thank you
Yes.
very much.
Yes.
The question, there are two questions. One is not too direct to what we are discussing, but maybe you, Dr. Liman will take it. The decision, maybe you've decided to have 2 children, and maybe your wife now changes her mind, maybe
And
because status has improved,
yes.
or somebody has put pressure.
Yes.
In such case, Philip says, what do we do? And then, is it possible to determine to estimate the date of delivery?
Yes,
Maybe
I think
let
me start from the last, then walk back to the first question.
Yeah.
Yes, it is possible to estimate the expected date of delivery, especially when the pregnant woman knows the first day her last menses before the pregnancy was observed. That if she had had regular menses in the last 1 year before the onset of this pregnancy and she has not used any form of contraceptive, then calculation based on last menstrual period, which is the first day of her last menses, is very correct in telling when she will deliver. But it's an estimated date, so about 10 to 15% of that estimation falls in the proper square. You are going to deliver on 8th of August 2022, and indeed spontaneously she starts labor, deliver on 21st of August 2022. Okay. Majority will deliver about 30, 35 to 40% will deliver before that date, 2 weeks before that date. Okay. And that is normal. That is what we call term. Another significant chunk, up to 30, 35% of pregnant mothers too, will pass this precise date that was calculated, by additional 2 weeks. So acceptable as normal period for a pregnant woman to deliver. Okay. So it is possible to estimate the date you can.
So if
whether you deliver on it
if she doesn't
or
know
not.
Her date, what
if she doesn't know the date and she has gone to a health facility where a good ultrasound scan is done, especially in the first 3 months of the onset of that pregnancy, the date that is calculated through ultrasound in that instance is very strong in terms of the actual date of that pregnancy, and then it falls in line the same way this estimated date calculated for last menstrual period works. The question now will be somebody that doesn't know her last menstrual period or has forgotten, and he has not done ultrasound, even as at 7 months pregnant that she's sitting before you, she doesn't even have idea whatever is going on there. She just knew that she's missed her period and she's pregnant. Yeah. So that makes it pretty difficult. Yeah. Whatever estimation you do, even with ultrasound then, or by working your way back in pregnancy, can you estimate when probably you first observed that something inside your tummy has kicked your tummy? Yeah. If she knows that precisely, it will give us a guide. But somebody that did not remember when actually blood flows out of her body, and she took care of herself in that period, it will be difficult to really remember these ones, except some miracle or coincidence happened at that time. Okay. So these are the ways we will be able to really, estimate the date of delivery. Now, working backwards to the first question asked by Mr. Philip. Yeah. Well, this is more or less a social issue. Yeah. In the first place, deciding that you will have to should be a joint decision, you and your wife. Mm-hmm. And if she has reason to say, darling, can we add one more baby into the house? It behoves on you to convince her why you people shouldn't go that way anyway, once more. Or she convinces you to her side to say it is indeed necessary. Whether that happened or not, once pregnancy has been established, what we advise as gynecologists is that let that pregnancy, have antenatal attention, and then, manage till the end and deliver successfully.
Okay, thank you very much. I hope that question has been clearly answered. I'll go back to Metron. The antenatal care lessons, I see women being given lessons almost every time. What are these lessons and why are they important?
The antenatal lessons we have with them is, it's a multitude of women with pregnancy of different stages or trimester. Like some of them it's just their first time. They've not had the experience, but some of them has had 1 or 2, even 3, 4 experiences of pregnancy and birth. So all is just to prepare them. Let them have awareness of what is going on in them now, what they need to do in order to achieve a positive outcome for themselves and then for the baby. So the lessons, there are various ways or various topics we give on nutrition. So that what the mother needs to eat in order to build up her blood and also for the well-being of the baby. We emphasize on that. We also give lectures on lessons on exercise, which is very good for the woman when she's pregnant. We also let them know about what to do and what not to do or what to take, like the issue of drugs and alcohol and smoking. Some of them, they don't really know the implication. This is something they have been doing, probably they are addicted to it, but now they are pregnant. Like some of them is addiction is very difficult to deal with. But one thing I always tell them is, pregnancy is for a period of time, 9 months. So for you to abstain from such a bad habit that will affect your child, I think for 9 months, I think you're doing yourself a good thing. So we talk about that as well. And also the coming of the baby. There are some physiological changes, just as Toliman was trying to explain. Because some of them, it worries them. Because a woman, with pregnancy, you're bound to lose your shape. So they need to know why. They need to understand that pregnancy is a physiological and it affects all the systems. You tend to add weight.
And that they are still beautiful even if they lose their weight.
Some of them they'll tell you no, but we tell them yes you are. They'll tell you, look at my nose, it's bigger than what it were. Or look at my complexion, I'm darker.
You're still beautiful.
Exactly. Thank God for Dr. Da. You're still beautiful, whatever state, because you're bringing in a life. So those are the things we try to make them to be aware of. And also the preparation for birth. You have options. There are 2 options of birth. A woman could deliver on her own normally, or there could be surgical intervention. In this part of our world, most times a woman wants to deliver normally on her own. But then there is no harm in the intervention. But because of the notion they've had towards a surgical intervention, it is believed that if you can't deliver on your own, you're not a woman. So we try to disabuse them with that lecture, to let them know that there is no reasonable ONG doctor that will subject a woman to cesarean section.
For the sake of it?
Yeah, for the sake of it, or for the fun of it. It is no fun at all. There must be a reason. There must be an indication for a woman to be booked for cesarean section. So we try to disabuse their mind from such as well. Those are just one of the 2 lessons we want them to know, just to prepare them for the forthcoming baby.
So that means that there are great things to know in the lessons of antenatal care.
Yes, a lot.
To know about
a lot, yes.
Well, we should take a break at this moment, but not after I've given you, not before I've given you the number 0907 111 5342. Please call us so that we can hear your questions. We will take a break. When we come back, it will be more interesting because we are going to discuss the place of men in antenatal care and the decision you take for family planning after that, among other questions. Welcome back. You are watching Clear on Health on Africa Health Television on TSTV. We are discussing the pregnancy period and antenatal care with my two guests, Nurse Jane Abo and Dr. Liman Idris Mohammed. Dr. Liman, during antenatal period, there are investigations that are carried out, and I think there are quite a number of them. Why are these investigations carried out? Because our viewers would like to know why you would like to take their blood or urine or whatever to check. Why are these investigations carried out? What are the investigations and why are they carried out?
Okay. Yeah, the investigations carried out during antenatal care, especially on the first day, and a few in your subsequent visit all the time, are the investigations done to achieve the aims and objective of antenatal care. And what is this aim and objective? A healthy, uneventful pregnancy period leading to the delivery of a live, normal baby with a happy mother at the end of the day. Now, this is the final aim we are looking at. And to achieve it, this we call urinalysis. It tells us about if the kidney is malfunctioning, throwing protein into the urine, or the sugar is too heavy that the kidney cannot handle and is being lost into the urine. These two things can tell us about hypertension and diabetes. And we know diabetes is a big, issue that when it coexists with the pregnancy, you have to be on your toes to be sure you are beyond the complication or the challenges the conditions will pose in a pregnancy so as to achieve a good result at the end of the day. Then we have HIV screening, hepatitis, as well as testing for syphilis. These are conditions that we all know can affect pregnancy and the forming fetus in one way or the other. And as well, in some of them, for example, like HIV, it will help us to, reduce its impact on the pregnancy by giving treatment to the mother, as well as soon as the baby is delivered, the treatment can be given prophylactically to the baby to reduce, the impact of such disease. Those are the ones that we cannot cure. For example, the ones that we can cure include syphilis. You do a test for syphilis and it is positive, what we do as clinicians is to do another step, to confirm that indeed it is not just a false positive from the lab. If that confirms it, simple treatment with a medication for 5 days will treat the issue of syphilis, and the impact on the pregnancy can be abated. Then we have that testing for hepatitis. Also, we know that hepatitis, yes, the mother might have had hepatitis long before she became pregnant. Is remnants or evidence of that infection we're seeing. So if we do the test, we look at it and determine, is it that the mother is currently having hepatitis infection ongoing? We run another more senior test to the first common or routine ones we do. And if it is, then we assess the mother's system and see if she will require treatment. We start treating the mother condition in the first instance, because all this infective process, in the active stage, can even lead to pregnancy loss. We don't want to lose this pregnancy, and we don't want the pregnancy to continue, and then the disease would have affected the fetus. By the time we're having a baby, we have baby that will be carrying to the hospital every year and then. So that is one. If the mother doesn't require treatment, we want to also protect this baby when delivered by giving immunization against hepatitis as soon as the baby is delivered, so that even if the baby has not acquired it during the pregnancy, if it's acquired from breast milk as the mother breastfeed the baby would have been armed with enough immunity to destroy any viral particle that might go through the breast milk to the fetus. So these are some of the tests. Then we do scan, as I said earlier on. Scan is also done, one, to test that the pregnancy is normal, it is in the uterus, the baby that is forming normally. If there is any congenital abnormality seen, that congenital abnormality seen is interpreted in the context of correction, possible correction and survival after delivery. If the congenital abnormality that is seen is so grievous that even if the pregnancy is carried to term, the chances of that fetus spending life with us more than, up to 5 minutes is not there, then we don't have to engage a whole hog of 9 months of pregnancy, knowing that in less than 10 minutes of delivery, if delivery actually is also achievable by, spontaneously per vaginal, there is no baby anymore. We can now advise on how to stop that pregnancy and allow room for a normal pregnancy to set in earlier than waiting for 10 months and you deliver a monster that in the next 3 minutes is dead, and then you are even not interested in looking at it because you don't want to lose your sleep in the next couple of days. That is the importance of scan. Then, depending if we find any baseline comorbidity in the mother, that warrants certain specific investigation targeted at issues that the mother have, to be sure the mother is okay. Now, let me quickly talk about prenatal care. Antenatal is, yes, a woman wants to be pregnant, she's pregnant. Anything you do to take care of that woman as from that point is antenatal. But that is before delivery. But before you engage to achieve a pregnancy, there is this concept of prenatal care, which is when a woman, an intending mother, is assessed health-wise and be prepared even before the pregnancy sets in. And this is where certain comorbidities or disease conditions that the woman has had before pregnancy sets in, you can change the drugs to those drugs that are pregnancy friendly. You can stop those that are not friendly at all and then give the woman a form of medication. Then you can control those comorbidity to a safe level that when pregnancy ensues, the complication did not start as soon as the pregnancy has started. And if a woman enters pregnancy in a positive state of this comorbidity, that is the complication, and what you do to achieve seamless pregnancy in those mothers is less than if you don't have those kind of care and the woman is pregnant before you.
Yes, maybe you should quickly also mention among the more common things, blood group.
Yes, part of the test. Yeah. These are all what we need to know. Should in case we have complication, you need to transfuse the mother, or part of preparation for delivery, in which we advise every pregnant woman to at least donate 1 unit of blood that pregnancy awaiting the time of delivery. We pray you don't need it, but if you need it, it will be handy.
Yes. Thank you very much, which means you should be checked up. You should not miss it, because it's important for you, it's important for your baby, and it's important for your delivery period. Now, I want us to discuss the involvement of men in antenatal care. Should men be involved, or shouldn't they be involved, and what are the reasons?
Right. One of our callers, Mr. Philip, before he states his question, he said it takes two to achieve pregnancy. So if it takes two, that means the husband and the wife. And I see no reason why the husband and the wife shouldn't participate in an antenatal. The part the man has to play has a long way to go. One, it gives the woman a psychological support.
Yeah.
Telling the woman, I'm in agreement with this.
Okay.
Yes. And because the essence of even this discussion is how we can encourage our women, motivate them to come for antenatal. Because antenatal guidance is poor. But whereby a woman is pregnant and she comes to the antenatal with the husband, it will give her that moral support. There's a way the women feel, you know, you're going with your husband to antenatal. And then there are things also that will teach them. You know, that period is a period that you cannot really predict women. It comes to individual based on who they are. Some of them are also very, very forgetful. We talked about the lessons we give to them, some of the informations. Like if the husband should follow the woman down for the antenatal, some of those information, peradventure she goes home and she's not practicing them, the husband can easily remind her. This is what they say, like the area of nutrition, which is very, very basic for a woman to be well fed. Apart from even reminding, you know, that will also make the man to know that the line of the woman's nutrition at this stage now should change. Because the woman should engage in more blood-building nutrition that will help her to have a normal, healthy baby, not a low birth weight baby. That's one thing again. You know, I forgot to mention one of the topic we teach again is on family planning. That comes after delivery. And so the man need to be involved to know, because some of them, they have misconception about the family planning. They'll even tell you it's a woman thing. But yes, it's a woman thing because the majority of the method we have presently, they are women friendly. But then the woman needs your support as well, your agreement with her, so that she can carry it out successfully. The essence is just for the couple to space the interval between one birth and the other. That's just the essence of family planning. But if the man comes and is well informed about what family planning is all about, he will definitely want to support the woman. That's one again. Then another one again, by the time the man follows the woman to antenatal and sees the interactions that takes place, because it's really, really interacting. And I want to state this. If you've not been coming for antenatal, you're missing. Because a lot of women, like I know a woman that came to me and boasted, I think that was her 7th pregnancy. I know they come antenatal. Now this one, they force me because they say this. No, you're missing. There's so much to learn. You know, and even on gathering, you make friends with your fellow women as well. And even sometimes we chip in things like women empowerment. Because some of the women, they will tell you, oh, when you say do this, they'll tell you, I don't have money, or my husband did not give me money. So we try to chip in issues like women empowerment. Once you are empowered, some of those little things, you can be able to do it. Because it's for your own safety, for your own health, and the unborn child. You mustn't wait for your husband to support you financially. Those are some of the things we teach them to in the antenatal. So there are a lot that the woman has to learn and has to gain from antenatal.
Thank you very much, and thank you also, Dr. Liman.
Okay.
Thank the two of you for coming. We will discuss tomorrow. We'll continue this discussion. In our next discussion, we'll discuss delivery. Just delivery with my two guests. And then the discussion that will follow after that, we will discuss complicated or difficult deliveries. They are very exciting. But I hope you have had a lot of take home from this discussion today. Why are you investigated? When you should start antenatal? Why you must let the doctor or the nurse know you are pregnant, even if you are hiding it from other people. Do not hide it from them, so that they will know it's a pregnancy, it's in the right position, and it's going on well, and it's 1 or 2 or 3 babies that you are carrying. I hope you've also learned how useful it is, you know, for the lessons that you hear. And then the last thing we're talking is the involvement of men. We would like men to be involved for the reasons that my guest has said. Thank you very much for your viewership, and we want to thank at this point also our media crew. Until tomorrow, goodbye for now.
But for 3 days.
Yes. One said that the knife-hungry doctor was waiting. That I refused to go to theater. I said, I think we can manage. It's 4 kg baby, but it's coming. Let me manage. But I'll watch the last